This video will cover the definition, causes, transmission, incubation period, pathophysiology, clinical features, complications, diagnoses, treatment, and prevention of whooping cough. Whooping cough, also known as pertussis, is a highly contagious respiratory infection. It is defined by severe, prolonged coughing fits, often followed by a high-pitched whoop sound upon inhaling. Pertussis means intense cough. The primary cause is the gram-negative Coccobacillus Bordetella pertussis. Milder infections can be caused by Bordetella parapertussis and Bordetella bronchoseptica. It is mainly a childhood disease, with most cases occurring in those under 5 years of age. Transmission occurs from person to person through respiratory droplets. This happens when an infected person coughs, sneezes, or talks closely with others. The incubation period for whooping cough is typically 7 to 10 days. The bacteria attach to ciliated epithelial cells, producing toxins that damage the cilia. This impairs mucus clearance, leading to accumulation in the airways. Airway irritation and inflammation cause severe coughing spells and hypoxia, leading to the characteristic whooping sound. The first stage, the catarrhal stage, lasts 1 to 2 weeks. Symptoms include runny nose, sneezing, conjunctival redness, low-grade fever, wheezing, and a mild cough. The second stage is the paroxysmal stage, lasting 2 to 4 weeks or longer. Coughing episodes increase in severity, often followed by the high-pitched whooping sound. Other symptoms include vomiting after coughing, breathlessness, exhaustion, and cyanosis. The third stage, the convalescent stage, can last weeks to months. It is marked by a gradual reduction in cough frequency and severity. Patients experience a persistent mild cough, improved appetite, and fatigue. Complications can include pneumonia, atelectasis, otitis media, and apnea. Gastrointestinal complications like rectal prolapse, inguinal or umbilical hernia, and nutritional complications like weight loss and dehydration may also occur. Diagnosis involves a complete blood count showing leukocytosis with lymphocytosis. Other methods include swab culture, PCR testing, and a chest X-ray. The differential diagnosis for whooping cough includes bronchiolitis, pneumonia, cystic fibrosis, tuberculosis, and asthma. Treatment uses macrolides as the first line of defense. Specific medications include erythromycin, azithromycin, and clarithromycin, each with distinct dosing schedules. Supportive care is critical and involves ensuring adequate hydration and rest. Other measures include oxygen therapy if hypoxic, cough suppressants, antiemetics, antipyretics, and suctioning of secretions. Hospitalization is indicated for infants under 6 months of age, those with severe coughing spells, apnea or cyanosis, and those with respiratory distress or pneumonia. Prevention includes the DPT vaccine for infants and erythromycin post-exposure prophylaxis for those exposed to the infection. Thank you for watching this video on whooping cough.